I'm Dale Dalenburg, MD, and I was trained in Arizona at the University of Arizona College of Medicine, and came to Kansas for orthopedic internship and residency, and worked a little bit for the VA after that, and then went off to Buffalo, New York, and did a spine surgery fellowship. So that's my subspecialty training after residency. When I was in training in my residency, nobody seems to know what they want to do when you start that, and everybody casts about looking for ideas. And I gravitated towards surgical subspecialties. I kind of felt better being the specialist with the narrow discipline that everybody was coming to for answers, as opposed to sort of being the generalist that had to send everybody off to the specialists for the specific answers. So that was a better fit for me. And I looked at a variety of specialties, including surgical specialties, including urology and ENT and ophthalmology. And I decided that I liked orthopedics. And one of the deciding factors was I had a professor who was sort of the emeritus professor at the time, because he was older and had turned over the mantle of the department chairmanship to somebody younger. But he used to come around on the rotations, and he was always interested in the history of medicine. And so he had actually published some books on the topic, and he was pretty fascinating. And so I was very fascinated with orthopedics more than the other fields, just because I had good mentors like that. On our first appointment with a patient, we try to get a thorough history and physical, and we're not just doing surgery. We're trying to figure out what people need. Sometimes it's just a pain management problem. Sometimes there's a lot of non-operative care to do. Sometimes there might be surgery, and we try to get that information all together. If they've had a lot of people come that have had studies elsewhere, they didn't bring them necessarily. We try to gather up what other operations they've had to send for the op notes, send for the records, send for the outside x-rays, MRIs, whatever they've had. And that first appointment, we just try to get everything together for the patient. The great thing about working at Ransom Memorial Hospital is that more than any other facilities I've been in, Ransom has more of a teamwork approach. I think that Ransom Memorial is a really good collection of a lot of resources for a town this size. It's very difficult to go to many hospitals in smaller towns and find most of the things you need in one place. And it's difficult to find, primary care doctors that are working with the specialists, that are working with the nursing staff or social worker or whoever else, where they're actually all working together.